The effects of the medication, guys, are short term. Yes, your inflammation will come back when you stop. Yes, your insulin resistance will come back when you stop, but not if you replace it with proper lifestyle interventions. The medication reset is scary because essentially the medication reset is take a break and then get back on. And then when you get back on, your philosophy changes. You're trying to stay on the lower dose. But how in the world do you do that without blowing up? Lady Hawk, I lost 80 pounds and I'm pre-diabetic. That's freaking awesome. I would love to help you reverse your diabetes entirely. That would be my goal. Which peptide is a gut healing peptide? So there's two peptides that I like to think of when I think of gut healing. I like to think of BPC 157 and KPV. And we actually have a peptide that contains them both. They're both compounded. So BPC 157, KPV. What is AOD? So AOD is a fragment. What it actually is a fragment of the human growth hormone. So it's specifically, we use it to mobilize body fat. So remember, when you're insulin resistant, your body is, it's not flexible. The metabolism is struggles with burning fat. So you stress the body out when you put it into a caloric deficit, because when you put it into a caloric deficit, that's what it wants to do. It wants to burn fat. Should I alternate my start dates on Monjaro? Uh, I guess we would need more information. Like, I'm not sure if you're asking that for a specific reason, or what the context of that question is. I was on 0.25 Wegovy and I had to stop because I got colitis twice. My gosh, guys, do you see how, I mean, colitis, vomiting, nausea, stomach pain, diarrhea. Let me guess, you were on a higher dose. I'm guessing you were not on a lower dose. What dose were you on? I'm really curious. And I hope that you guys can understand and learn why. Go get a good workout, baby. This is why I'm such an advocate for utilizing the lowest dose possible, because I don't want you guys to keep getting wrecked by side effects. I mean, that's freaking awful. Yeah, there you go. 1.7 and 2.4. Why in the world, and this is not towards you, why did the doctor keep telling you to go up? If you felt horrible at 1.7, why did the doctor say, let's go up? That's insane. I'll tell you guys, that's part of the problem. The problem out there is that there's no structure, there's no guidance when it comes to these medications. So many people are unfortunately just stuck following these very cookie cutter templates. And most GLP-1 clinics are massive telemed providers, and there's no interaction with the patient. There's no coaching to keep them on the lowest doses. So what if you're already on the highest dose? Straight up, guys, if you're on a high dose and you're stalled, then you absolutely need my coaching, because this is a very, very uh, difficult time. So I'm going to explain to you guys. If anybody, actually, let me ask you guys a question. Um, how many of you guys watching this are stalled out and you're on a large dose at the same time? Let me know. I'm actually curious. Who who is on a larger dose right now and you're stuck and you're like, I don't know what to do. Simone, generally the way that it affects your liver is positive, especially, specifically fatty liver disease. Fatty liver disease is absolutely something that is very, very positively impacted from the GLP-1s. So, what I meant to say, should I alternate my injection days? I'm on Monjaro and I'm 12 and a half and I'm diabetic. So, if you're a diabetic, that's a different story. No, you should keep doing what you're doing if you're a diabetic. Although if you're a diabetic, you should be focusing on reversing your diabetes, and that's absolutely something that we can help you out with. So we got a lot of people right now that are stuck and stalled. So, yeah, let's talk about this because this is a massive issue. So, a couple things can happen when you are on these larger doses, and I hear this happen all the time, right? Dr. Jones, I hit the larger dose and my results stopped. My results slowed down. I'm barely eating. I feel like crap. And there's a couple things that we do with patients that are in my program. We do a metabolic reset and we do a medication reset. And this is under medical supervision. Like, you don't want to do this on your own. The medication reset is scary because essentially, long story short, the medication reset is take a break from your GLP-1, resensitize, and then get back on. And if you do this right, what's going to happen is you'll be able to, and then when you get back on, your philosophy changes. You're trying to stay on the lower dose instead of increasing the dose. So that's the quick answer, guys. But how in the world do you do that without blowing up? Because I can promise you right now, if you try to do this on your own, you will likely start gaining weight. So this is a very delicate process between my providers and me because I know what lifestyle interventions that I can implement into my patients to mitigate and prevent weight gain as they slowly decrease their dose. So, and we've done this. We've done this many, many, many times. And usually at the same time, we are doing a metabolic reset. A metabolic reset is where we slowly have the patient eating more food. And guess what? When you're decreasing the medication, it's easier to eat more food. So we're handling two issues. We're putting you through a metabolic reset and a medication reset under medical supervision. And when you come out of it, you're off the med, you're eating a ton more. It's a true reset. And then we get to work. And then you start my protocol where we incorporate the fasting, the keto, the weight training, the supplements. We keep you on a low dose. We add powerful peptides like AOD 9604. Like all these powerful things are very, very complementary and they help. It's the only way. It's the only way to prevent it from happening. Thank you. Um, my thoughts on Tirzepatide versus Retatrutide. Retatrutide is the triple G. So Retatrutide, thank you guys. Retatrutide will be is likely better, but it's new, it's more expensive. So just stick with Tirzepatide, guys. Tirzepatide is great. I'm not sure with your TCS what you meant. I'm so afraid my inflammation will come back when I go off the medications. So the effects of the medication, guys, are short term. Yes, your inflammation will come back when you stop. Yes, your insulin resistance will come back when you stop, but not if you replace it with proper lifestyle interventions. So, and for everybody's case, it's an individual scenario. Some of you might be able to stay on a lower dose. Some of you might need um, to stay on a lower dose. It's a case by case situation that we can figure out. That's a tough one, Amy. Uh, that's a real tough one because you have an actual sort of direct issue affecting your bowels and your bladder. You'd have to stick with your doctor's recommendation on that because they're gonna understand the extent of that. Good morning, sunshine. Uh, AOD is a daily. It's a daily, and you can actually go up to twice a day if you really, really like the effects of AOD. Big Sash, good morning. What am I having for Thanksgiving? I was just talking to my fiance about that. Let's get a summary of the Bellevue study because I think somebody here wants us to check it out. So let's check it out. I have a feeling it's going to be so bad. Let's see. Let's see. The Bellevue study was a groundbreaking experiment led by Arctic Explorer. The study aimed to investigate the effects of an all meat diet on human health under controlled conditions. Uh, yeah, I mean, this looks like a carnivore diet. Yeah. So, I mean, the carnivore diet is very, very powerful. And if somebody can adhere to the carnivore diet, I'm all for it. It's just not sustainable for most people. Uh, Intermittent fasting and time restricted eating to me, guys, is a much more sustainable lifestyle. Even a ketogenic diet long term, um, is not sustainable for most people. It's just the reality of the situation. Guys, AOD is powerful. It's awesome to stack with your GLP-1s. It's my favorite peptide to stack. Average cost is a couple $100 a month. It's gonna depend on your, dosing, of course. So shoot us a text message here and get yourself scheduled for a free consult so that you can get an idea of the cost, you can get an idea of how we utilize it, what would be our recommendation, and so forth. Can I just stop the semaglutide when I finish my vial, or do I have to wean off? I can't give you medical advice, but most people, if they just cold turkey stop the GLP-1, will experience even faster weight regain. Weight regain, I say even faster because you're already going to get fast weight gain even when you wean down. Most likely, most people, this will happen unless you have some targeted, powerful lifestyle interventions that you can replace with it. Yes, guys, you can use your HSAs. We do take HSAs and FSAs. Uh, Guys, if you just hopped into the live, welcome, welcome. So I got 16 people watching me. Ooh, 4 people on Twitter and 12 people on YouTube. Say hi, guys, on YouTube and Twitter. There's no engagement whatsoever. Nobody comments on Twitter and YouTube. That's funny. But you can comment, guys. I'm live. You can this is a Q&A. Feel free to ask me any questions at all. Um, with obviously people on TikTok, this is the understanding that you can ask me questions. But what about pancreatitis? Pancreatitis and PTS, these are two completely different things. Okay, so pancreatitis is inflammation of the pancreas. And inflammation of the pancreas is a very serious issue. You don't want to F around with pancreatitis. I mean, that can put you in the hospital and even worse. So, this is why we always do pancreatic enzymes. We do the labs before prescribing GLP-1s. It's um it's absolutely vital, in my opinion, to make sure that you check your pancreas out and it's just important to stay safe. You don't want to get on these medications if your body is on the path towards developing pancreatitis. Uh, it's not a side effect, it's a complication. Very, very different. There are some rare complications: pancreatitis, gallstones, biliary disease, stomach paralysis. And that's why you guys, in my opinion, should utilize an approach like mine, which utilizes the lowest doses. Let's stay safe out there. Let's not get wrecked by nausea, diarrhea, and vomiting. Like, doesn't that sound awful? Dana, shooting us a text message right here. is the best way to reach out. What do you think about berberine and ALA? Those are great supplements. Berberine and ALA is great are great. Are they gonna be game-changing components to the program? No. They you need the most important aspect of what we do is the GLP-1, the AOD, and the lifestyle. We do have some really powerful supplements that we recommend, but they're more like the base supplements, the magnesium, the fish oil, the vitamin D, and then, of course, if you're on GLP-1s, um, if you're on GLP-1s, the digestive enzymes and probiotics help. How can you get rid of loose skin without having to get surgery? Unfortunately, when your skin is too loose, there's not a lot you can do other than like, if you've already developed a loose skin, you can try to put on a bunch of muscle, but none of you guys are gonna put on enough muscle to fully fill out all the space from the fat. So this is why the ultimate solution is doing your weight loss journey correctly so that you don't develop loose skin to begin with, or you minimize the amount of loose skin. Elisa, I only wear the glasses in the morning because they're daytime blue light blocking glasses, and I think in the morning I have these big lights, as you guys can't see, but I have this my filming lights are on, and, the blue light from all the screens, and so I I feel I don't know, it's interesting. I've been wearing it for about a week now in the mornings. I felt like there was a couple days where my eye was a little yeah, I wasn't feeling as good. Now I think it's better actually, yeah. So I think it's probably a good idea for me to wear these for these first 2 hours just because naturally, if you look at the sunrise, you don't get blasted with light immediately, it's a process, right? So, um, unfortunately, I couldn't find any research timing this, but my own conclusion is wearing them in the morning, if you are gonna experience intense light like this, is probably a good idea. Lauren, I'm on 7.5 milligrams and I'm not losing weight, but I have suppression. Lauren, welcome, welcome. You are not alone. There is a lot of people that are struggling just like you. And we've talked a lot about the solution. The it could be insulin resistance, like a lot of insulin resistance. It could be a lot of inflammation. It could be thyroid issues. It could be cortisol issues. And then ultimately, the coaching is kind of like what Lee was saying. Like the coaching is really the summary of it all because we can work with you to fix the issue. We can work with you to solve the problem. You know what I mean? So it's it's absolutely something that is the ultimate, right? Because we know how to check with the blood work. We know how to check for the lifestyle. We know how to figure out what the problem is and then fix it for you guys. Um, how much is a full blood work panel from us? If you guys want a complete functional weight loss panel, it's $99. If you want the full hormone panel, it's 149. And if you want the both, the ultimate panel, it's 199. What do I think about Lipo C and MIC B12? I think they're great. I think the lipotropic shots can absolutely help, but again, these are not game-changing components to the program. So they're, they're cool, they can help. Amy, we don't focus on counting calories either because counting calories is also very unsustainable. So, truthfully, when you get into the flow protocol, which is my structured program, uh, we partition the calories where you are getting one window, one really long window where you're not eating, and then you have the rest of the week when you're eating. And that's the key to fixing insulin resistance and inflammation. And you spread out and partition your calories that way. Yeah, Mookie, we do both. Down with the thickness says you are part of the problem. I'm part of the problem, guys. I didn't realize that was such a problem. I didn't know it was such a troublemaker. This drug was made for heavy type 2 diabetics. It's an interesting thought process. Since when do heavy diabetics become so entitled to where the rest of the world doesn't get the benefit? I think that's an interesting way to look at it. Um, the shortage sucks, and yeah, aren't we all heavy and insulin resistant? Yeah, we are, but, there's definitely some entitlement there, which is really interesting to me. Um, just to educate you, uh, when you buy compounded GLP-1s, you're not taking away from diabetics or heavy diabetics for that matter. If you were to prescribe for obesity somebody Ozempic or Mounjaro, which are diabetic medications, which insurance covers for diabetes, sure, that might contribute to the shortage problem. But compounded medications do not take away from diabetics. So, I hope that makes sense. Yes, I've seen the documentary, Game Changers, and I think that it's very skewed, portrayal of a vegan diet or a plant-based diet. My opinion is we should be eating a ton of plants, and we should be eating meat. We're omnivores. Humans are omnivores. We're not carnivores, we're not vegetarians. So, I think that the results that you see when you take somebody eating a standard American diet and you flip them over to a vegetarian diet, which reduces processed foods, and you know, you put that effort to be a vegan or a vegetarian, then you're doing the right things. And so I think the results are always going to show um, a skewed portrayal. But if you take a healthy omnivore versus a healthy vegetarian, I think if we actually had those studies, you would see, in my opinion, probably better results on the omnivore side. But I don't know. I've just seen too many issues with people that don't eat meat, don't eat protein. When should you start seeing results on AOD 9604? Um, whew. So I 42. The problem is you're on the maxed out dose. You're on the maxed out dose for a year and a half and you're not losing weight. And you're hoping that adding a second compound is going to trigger more weight loss. Let me ask you a question. What do you think is going to happen? Let's just say the AOD did trigger some more weight loss. Now you're on two different weight loss support aids. What do you think is going to happen when you stop the maxed out dose and the AOD? My integrity, guys, is too high to just sell you a bunch of shit, knowing that it's not going to be good for you long term, knowing that you're going to waste your money. I can't do that. But what I can tell you is what nobody else is gonna tell you, that you need to fix the issue that you're in. You need to fix the fact that you're on the maxed out dose and you're not losing weight. That's an issue. That's a huge issue. I love AOD, but you have to use AOD correctly. Otherwise, you're throwing your money down the drain. And that's why my coaching is so vital to make sure that you implement proper actions, proper lifestyles so that you're not throwing your money down the drain. I'm not familiar with the stellate ganglion block, calming high anxiety. Very interesting. A nerve block to I'm not familiar with that. What is AOD? AOD is a fragment of the human growth hormone. It's a very powerful fat mobilizing peptide, and um, we like to pair it with our GLP-1 because with the GLP-1 medication, um, you are you're insulin resistant and you're not mobilizing fat as well, so the AOD helps you mobilize more fat. I used it for 10 months, 425 a month, 21 pounds. I gave up, couldn't afford it. So Laura, um, the problem is you need some guidance. You need some coaching. You need some support. You need to make sure you're doing this correctly. And that's what we do. That's where we have support. For that same price, you can get your GLP-1 and you can get some coaching with us. So you can get some support. Exercise type and length for non-fit people. It doesn't matter whether you're fit or non-fit. The most important exercise is that is resistance training. Resistance training is the most important form of exercise, without a doubt. Anna on YouTube, thoughts on DNF10? DNF10 might be a peptide worth looking at. It appears to be a potential appetite suppressant aid. Some people are stacking it to their GLP-1s, but again, like we can keep stacking more and more aids, or you can get off your ass and go to work. And I don't mean that towards you. I mean that with love when I say that. We have to target both sides. Taking aids, taking supplements, taking um, GLP-1s and peptides. Don't get me wrong, I'm all for it, but the base needs to be lifestyle. The base cannot be, "Now I need the DNF, now I need the semaglutide, now I need the AOD, and if I don't take all of that, I'm screwed." Think about that. Does that sound stable? If you have to take 4 or 5 different weight loss aids just to stay at your weight, does that sound good? Do you feel good about that? What happens if you can't get those things anymore? Talk about instability. Louisiana, I'm on the dosage 7.5 plus, I was taking Lipo Boost and cinnamon. Why did my blood sugar drop to 53? I don't know. I mean, I don't know who could answer that question. There's like a million things that could have caused your blood sugar to drop. Uh, were you fasting for a long period of time? Do you have some other medical conditions that cause blood sugars lowering? Do you have any other medications that you're taking? I mean, I have no idea, but I would go see your doctors and make sure that there's no other medical conditions going on. Jessica, were you referring to my statement about not sustainable to be taking a bunch of different weight loss support aids? I think that's what she was referring to. Yeah, for sure. And this is why I find it so fascinating that people fixate on, "Well, add this, take this, stack this." Well, I'm on the maxed out dose of Tirzepatide. Can I add AOD? Can I add the DNF? So now I'm taking like 4 or 5 different peptides, which I can't afford for more than 3 months, and I lost all my weight, but then I stopped, and it all comes back, and now I'm depressed, I'm overweight again, and now I'm broke. Like, that sounds awful. The one thing I can promise you guys, if you join my community, is that I will do my best to save you the most amount of money. That's my promise to everybody, is that I wanna save you guys the most amount of money, helping you to sift through all the bullshit, helping you to sift through all of the garbage. My excitement is coaching more so than selling you a bunch of shit. I don't know. I yes, I'm gonna sell you some stuff, of course, but I'm gonna do my best to sell you really only what's needed and develop these lifelong relationships with you. That's my business. That's my goal, is building this Flow Academy membership where there's trust and there's results. Jessica, I've heard GLP-1 helps lose belly fat in menopausal women. Could you explain how? So, yeah, so GLP-1s, it reduce insulin resistance. And when you reduce insulin resistance, you are when you reduce insulin resistance, you target belly fat. I mean, it's a direct path. Go with the flow, baby. If you guys just hopped into the channel, welcome, welcome. So my name is Dr. Jones. I have clinics. We service across the nation, all 50 states. Nobody is doing what we do. Have I researched myo-inositol? Myo-inositol is great. I wouldn't say you're gonna rever you're not gonna reverse your insulin resistance with just myo-inositol. That I can tell you. Is there a particular product that you're referring to? I'm gonna look up this if there's a particular product you're talking about. D Cairo. Let's see. Myo-inositol D Cairo. Let's see. With with MTHF folate. Um, no, I haven't heard this supplement. Doesn't They don't even advertise that insulin resistance is one of their things. Hmm, interesting. I mean, it looks like look, supplements are either gonna help or not, you know what I mean? Yeah, Dr. Trickholm. What kind of doctor are you? And welcome, welcome. Love discussing things with clinicians. And yeah, it's interesting for sure. I do more of like a low carb slash keto, but definitely not a hardcore keto for sure. And then ultimately, honestly, I more prefer a cyclic keto. So for our patients, we'll do keto, like low carb keto every day for a couple months. And then when we get people towards the goal, we start transitioning to a cyclic ketogenic lifestyle. Yeah, I'll take a look at it. Oh, gotcha. I saw the doctor, so I thought maybe you were a doctor. Um, let's see. How do we know which is the best to take of the GLP-1? Well, there's really only 2 options. There's semaglutide and there's tirzepatide. That's basically it. So, semaglutide and tirzepatide, and tirzepatide is better. Tirzepatide has better research to back. Well, it has research to show that it's better on the results, lower on the side effect profile. I'm fasting till tomorrow, that's for sure. I had dinner last night. I'm skipping dinner tonight. No dinner for Dr. Jones tonight. I'll probably go live tonight because it's easier to go live when, it's when I'm not eating dinner, it's easier to go live, that's for sure. The triple G is already out, guys. Yeah, the triple G is already out. Tummy tuck after 100 pounds lost, should I look into BPC? Yeah, BPC is great. BPC is awesome. BPC is anti-inflammation and supports musculoskeletal healing. Lana, can you reduce insulin resistance without the shot? Absolutely. Yeah, absolutely. You don't need the shot to reduce insulin resistance. I'm a big fan of the shot of the GLP-1 because it really does make it easier to do the things that you need to do to fix the insulin resistance. So that's why I'm a fan of um, that's why I'm a fan of the GLP-1s. But, the fasting, the keto, the weight training, like all this stuff you can do, you don't need the GLP-1s. But if you feel like you're struggling, you feel like food chatter is a barrier, then that's where they come in. That's where they come in handy. I just watched your video about being cold. I'm always cold, so I need to eat more. Yeah, so guys, cold, tiredness, brain fog, constipation, these are all downstream effects of the survival mode reaction from the body where you're not getting enough calories, you're not getting enough nutrition. That's why your weight loss stalls as well. I'm on week 5, no weight loss, still major stomach pains and sickness. Yeah. Chelsea, that's like everybody else, you know, there's a lot of people that run into this very issue, guys. So, I think we need to address this. Unfortunately, I'm out of time. I do need to hop off, and I'm gonna do my we get a really good mobility workout this morning, so I'm excited. I'm gonna do some mobility. Is BPC 157 dangerous? No, BPC 157 is great, guys. Peptides are very safe. If you guys are ready to join a community, if you want to kick some ass and be part of something great, shoot us a text message. Um, yeah, the walking backwards thing. I was doing that for a while. I do need to warm up actually. I should be walking backwards. That kinda I was doing that for a while and then I stopped. You actually reminded me that I need to get back to walking backwards. Let's do that. I'll wind down with my little 10-minute backwards walk because that's how I warm up anyway, so thank you for reminding me. So I'm gonna hop off of YouTube, guys. This is the best number to reach out to my team. I'll stay with you guys for 10 more minutes on TikTok.
There's nothing worse than seeing a patient just like you starting these GLP-1 medications and end up short of your weight loss goals. How much better would you feel about your journey if you are consistently making progress the entire time and, more importantly, saving a ton of money by not needing as much of the GLP-1 medications? I have the answer for you to achieve lasting weight loss and save money on your GLP-1s in the long run.